So as we've seen in the heart lectures, arteries always carry blood away from the heart. So remember the A in artery and the A in away. Arterioles are the smallest branches of the arteries, and capillaries are the smallest blood vessels. It's only in the capillaries where the exchange between blood and interstitial fluid can occur. So it's only at the capillary beds where the oxygen and carbon dioxide can be exchanged. Venules collect blood from the capillaries, and veins return blood to the heart. Where are we going to find the largest blood vessels? Well, we've already covered those. They attach to the heart. So we've got the pulmonary trunk, which carries blood from the right ventricle to the pulmonary circulation. And then you've got the aorta, which carries blood from the left ventricle to the systemic circulation. The smallest blood vessels are the capillaries. They have the smallest diameter and the thinnest walls, and that's where chemicals and gases can diffuse across the cell walls because they're only one cell thick. When we're looking at generally the vessel wall structures, most of them have 3 layers. They have, so we're starting from the inside. So the inside diameter closest to in contact with the blood passing by, that's the tunica intima. So remember I for inside, intima. And the externa media is in the middle, so M for middle, and tunica media is in the middle, M for middle, and the tunica externa is on the outside. So remember E for exit, on the outside. Sorry, I had a bit of a cough. So looking a bit more closely at the inner lining, the tunica intima, that is lined with endothelial. It has a connective tissue layer, and it has an internal elastic membrane. So in arteries, it's a layer of elastic fibers in the outer margin of the tunica intima. So this is only true of arteries, and we'll see why in just a little minute. The tunica media, the middle layer, contains concentric sheets of smooth muscle in loose connective tissue, and it binds to the inner and the outer layers. So the external elastic muscle of the tunica media separates the tunica media from the tunica externa. The tunica externa is the outer layer, and it anchors vessels to the adjacent tissues in arteries, and it's made up of collagen fibers and elastic fibers. In veins, it contains elastic fibers and smooth muscles. Then we also have what is called the vasa vasorum, which are the vessels of vessels. Now these are small arteries and veins in the walls of large arteries and veins. And these help supply the cells of the tunica media and the tunica externa so that they can continue functioning. So the larger arteries have, in fact, their own blood supply. So here we've got a diagram showing you the typical makeup. If we start over at the right side, you can see that there's a photograph of a microscopic slide, and you can see the difference between the walls of the artery with the thickness and the walls of the vein. The lumen means the center, the hole through the center. So now if we look over at the left-hand side of the diagram, we can see that we have the 3 layers made up. So the purple one, which is closest to the blood moving past, is the tunica intima inside, the tunica media, which has the smooth muscle, and the tunica externa on the outside. So let's look at the differences between arteries and veins. Now they run side by side, so they normally run with a nerve as well when we're looking at the gross anatomy. So we have what is called a neurovascular bundle. So we have an artery, a vein, and normally a nerve running together. So keep that in mind when you have people that are coming in with trauma. So if they have a numb foot or a numb arm and you're thinking that maybe they've got some nerve damage, you also should suspect that they've got some vascular damage as well. So arteries and veins run side by side. Arteries have thicker walls because they have to withstand higher blood pressure, because of course they're receiving blood from the systemic circulation that is high in oxygen being pumped out from the aorta. So with every beat of the heart, the arteries have to be able to stretch and then relax. So a collapsed artery has a small round lumen, an internal space, whereas a vein has a large flat lumen, so it doesn't have enough structure to hold itself open. Vein linings contract and artery linings do not. Artery lining has folds and arteries are more elastic. Veins have the distinctive presence of valves. We'll talk about valves in a minute. Here again is that picture, so you can see that the artery down below, much thicker walls, able to stand up on its own, whereas the vein looks quite floppy, and if it hasn't got any circulation going through it, it will lie flat.